Autoimmunity is a confusing thing to most people. One common misconception out there right now is that we can cure autoimmunity, and that is not true. Where we stand right now in the early days of 2018, we do not know scientifically how to cure autoimmunity because that would require deleting an entire cell lineage from the immune system. When your immune system creates antibodies and creates T cells through clonal expansion against a certain antigen, even when the clonal expansion contracts and the acute attack has slowed down, there are still memory T cells and memory B cells against the antigen. If that antigen is your self-tissue, then you forever have T and B memory cells against the self-tissue. So for example, if we're talking about Hashimoto's disease, then you forever have T and B memory cells against the thyroid gland. So even if your antibody titers drop or come down to within normal range, that does not mean that we have cured your Hashimoto's disease. Antibody titers ebb and flow, meaning they go through cycles of high and low. So if you test one time and you have lab high titers, that is diagnostic or contributes to the diagnosis of an autoimmune disease. If you test again later and they're gone, that does not mean that you've cured the autoimmune disease. It means that you likely tested during a downward slope of the antibodies. So you want to test over time to see what's going on with the antibodies. You can see that antibody titers have dropped overall, but once you have them, they're not going away. So the clinical goal for autoimmune disease is to suppress symptomatology or make you asymptomatic for as long as possible between flares. We are human, we live in a very toxic and unhealthy environment, so flares will come. So the goal is to have as much space between flares as possible and to teach you or to work with a practitioner that's going to teach you how to manage flares and get back to pre-flare or a life at optimal as quickly as possible when a flare occurs.